Well, if you didn't know, September is Chronic Pain Awareness Month, and we're joined by Dr. Mark Malone, a board-certified pain specialist and founder of Advanced Pain Care. He's also a chronic pain patient himself. All right, Dr. Malone, you're here to help raise awareness about chronic pain and its treatments. First off, what is chronic pain?
Well, Curtis, when we talk about chronic pain, we're talking about severe lifestyle-limiting pain that will not allow a person to live a normal life. These patients can't get up in the morning. These patients can't go to work. Most patients struggle even taking care of themselves and their families. Some patients can't even sit or stand for more than a few minutes at a time.
Yeah, and how has it typically been treated?
Well, we use a lot of different ways to treat it, including medications, physical therapy, specialized spinal injections, and even surgery. But the most exciting and new development today is spinal cord stimulation. And this is a tiny device that we implant in the back, attached to a wire that goes into the spine and talks to the brain, telling it that there's no pain. The latest generation came out about a year and a half ago. It's called Burst, also DRG. The Burst technology is a new waveform that is a more natural language that talks to the brain in a more natural way, the way the brain likes to be talked to.
All right, so this is, I'm definitely learning a lot here. I haven't heard of that. I didn't know you could actually implant something into your spine, but I mean, do you see this as the future over medications and then spinal cord stimulation,
Yeah.
the surgery? How is that painful? How does that work?
It's not painful at all, Curtis. I had back surgery myself, and that was painful. I never really recovered from that very well, but when this new Burst technology came out about a year and a half ago, I was using it on my patients and getting great results, especially on what we call failed back surgery, which is what I had. It's a very painful condition. The new stimulator comes in 2 steps. You do a 5-day trial with a temporary wire that's placed under local anesthesia with a little sedation. The patient goes home and tries it out for 5 days with a remote control controlling it. Comes back in, we slip out the wire and talk about how much pain relief he got. Many patients are getting 100% pain relief with this. And that's what happened to me when I did my own trial 6 months ago. I had 100% pain relief with it, came back in 3 weeks later, got the implant, which is about an hour-and-a-half procedure, outpatient. I've been pain-free ever since.
Wow, that is good to hear, because I got some lower back pain as well. That it's not quite to the level. I haven't had surgery yet, so I'm going to hold off on this. But what is the difference between? I've also read about dorsal root ganglion (DRG), and what's the difference between Burst DR stimulation and DRG?
Well, these are 2 new types of stimulation that's revolutionizing the treatment of chronic pain. The Burst DR is very good for chronic low back pain and failed back surgery, which is what I had. It's excellent at treating the middle of the back, what we call axial back pain. DRG is another technique that's a little bit different. It allows the pain doctor to place a tiny electrode on or near an individual bundle of nerves, specifically like a bundle of nerves that goes to an extremity. For example, if you had severe foot pain, nerve damage in your foot or in both feet, like, for example, diabetic peripheral neuropathy or other type of nerve damage, the DRG is very effective for that.
Well, Doc, I really learned a lot today, and I'm excited about this procedure because it doesn't have medications involved. So where can our viewers go? I know there's tons more questions everybody has. Where can our viewers go to get all this information in one place?
I recommend a website called poweroveryourpain.com, Curtis.
And we'd like to thank Abbott for making that segment possible.